to this Bhekisisa Elections webinar. My name is Mia Malan and I'm the editor of the Bhekisisa Centre for Health Journalism, and my job today is to moderate this discussion. Part of my job is to make sure that by the end of today's webinar, all of you are clear on what the EFF, the DA, the ANC and independent candidate Zaki Ahmad have to say about how they will fix South Africa's healthcare system. Now, for those of you who are not quite clear on what those parties' manifestos say on health matters, we've got some help. Bhekisisa has developed an elections tool for which we've divided health into 9 categories, and we've put those categories onto a nice table on which you can click to find out what not just those 4 parties say about these health matters, but 16 political parties who are all standing for the May elections. So far, we've populated the tool with 10 parties' information, but by the end of the week, we will have the information of all 16 parties. And if you check the chat box on your Zoom screen right now, you'll find the link there to link and access that tool. We are live tweeting or mixing today's event. And if you'd like to live tweet it yourself, you can use one of 3 hashtags. It's Bhekisisa Webinar, SA Elections 2024, or SA Election 2024. These hashtags are in your screen on your chat box right now if you'd like to copy and paste them when you tweet or X. So here is how today's discussion will work. Our webinar will be about an hour and a half, and we have 4 panelists who represent the ANC, DA, EFF, and independent candidate Zaki Ahmad. Panelists will start off all making a 2-minute opening statement, and that will be followed by 6 respondents who are all health experts. They will ask parties a question about the health area in which they specialize and then give them feedback about their answers. And after that, we will have about 15 to 20 minutes for your questions as the audience. Now, I'm sure you'll agree that's a lot to get through. So we have time allocations for answers of our speakers so that we can be fair to everyone. And here is how I'm going to keep track of time. There will be a ticking clock on your Zoom screen in the top right-hand corner. And everyone will be able to see that ticking clock, not just the speakers. And each time that someone starts with their answer, the clock will start on 0. When there's 30 seconds left for them to speak, I will show this sign so that they know they should come to an end in a bit. And then when the time's up, I will show this sign. And 10 seconds after I've shown this sign, we will mute the speaker if they had not yet stopped speaking. And that's not because we're rude, it's because we want to be fair to everyone. And we wouldn't like you to sit here for 3 hours of a discussion, but get it done all within the 1.5 hours that we said the discussion will take. And that time allocation will apply to both politicians, so our panelists, as well as to the respondents. During the audience questions, we will not have signs and we will be a bit more free with time allocations. So here we go. Can I ask our panelists, so the politicians, to all put on your cameras, but have yourselves on mute unless it's your time to speak. I see Michelle, Zaki, Yvette, not yet you, so not our respondents yet, only our politicians for now. I see Tlaneng, Michelle, Zaki. We still need confidence. I see your confidence. Thank you very much. So we're ready to start. For the opening statements, our panelists have 2 minutes each to respond to the following question. If you were to be South Africa's next health minister, what are the first 2 things you and your party would fix within your first 100 days of service, and why? We're starting off with the Economic Freedom Fighters, or EFF, who is represented by Dr. Tlaleng Mofokeng. She's an EFF Manifesto Committee member. Tlaleng, you've got 2 minutes to make your statement and your response to answering this question.
The EFF government approach to health systems will be based on the pillars of prevention, of promotion, and education on healthcare. And as such, the EFF government will therefore focus on primary healthcare as a commitment to attain true and equitable universal health coverage and health outcomes for all people in South Africa. And as such, as Minister of Health, the EFF government will, in the first 100 days, increase the salaries of all healthcare workers and professionals in the sector to the international benchmark as the people who are key to actually offering services in a very fragile and fractured health system. The EFF government, in its first 100 days, will professionalize and employ community healthcare workers, in particular, as full employees of the state with full benefits to support the ongoing primary healthcare system for prevention, for early screening and support, for example, the postpartum visits, mental health outreach and screening, drug use awareness, as well as treatment support. The EFF government in the first 100 days will ensure integrated access to data and identify gaps in policy, in health systems, in clinical care, as well as in underlying determinants of health, such as access to water, food, housing, and healthy living and working conditions. And it's important that this health data be rapidly analyzed to inform policy, to set priorities that are specific for each district, sub-district, and as well as provinces, to foster interdepartmental collaborations to meet the specific needs of the specific communities. We know that ultimately EFF wants to see 24-hour clinics running in each ward. This is important as this will inform resource allocation and budget forecasting as a result. And the EFF, of course, views this as an important step as primary healthcare is a cornerstone of realizing universal healthcare coverage. Thank you.
Thank you very much, Tlaleng. That was great timekeeping, perfect timing. Our next party is the Democratic Alliance, who is represented by the party's Shadow Minister of Health, Michelle Clark. Michelle, if you were to be South Africa's next health minister, what are the first 2 things that you and the DA would fix within your first 100 days? Floor is yours. Michelle, you need to unmute yourself.
Thank you very much. So social development and healthcare really go hand in hand with each other. And as we face a crisis in this country, the DA stands ready to lead. Our vision for the first 100 days in government is clear: to confront food insecurity and healthcare head on, usher in a new era of hope and opportunity for all South Africans. Our social development policy underscores our commitment to address the root causes of food insecurity of South Africa. Millions still suffer from hunger and malnutrition, and our approach is multifaceted, tackling issues of food production, access, and nutrition for targeted interventions. Firstly, we pledge to protect and expand social grants, shielding them from the scourge of corruption that has plagued our nation for far too long. Under a DA-led government, the child support grant will be increased to match the official food poverty line, providing much-needed relief for struggling families. The NHI bill, while well-intended, poses significant risks to our healthcare system. Instead, the DA advocates for universal access to healthcare through governance.
Michelle's picture has frozen there, as well as her sound. Let's just give it 5 seconds to see if it's coming back. If not, we'll move on to the next speaker and we'll give Michelle another chance once we're done with the next speaker to complete her opening statement. Michelle, if you can hear me, you've frozen. If you could perhaps rejoin, that will be a great way to see if we can restore your picture. Let's, in the meantime, move on to our next speaker, who is independent candidate Zaki Ahmad, who's also a long-time HIV activist and a person living with HIV. Zaki, are you ready? You have to unmute yourself, please.
Excellent.
That's it. If you have 2 minutes, please go.
Our Constitution guarantees everyone the right to healthcare access. Section 195 of the Constitution requires a state that is open, effective, accountable, efficient, and uses resources effectively. For me, I'm not going to be a health minister. I'm going to be a member of parliament. And that's what I really look forward to, because primary healthcare is at the heart of my campaign, particularly access to mental health care. In the first week of Parliament, there are a number of things I would ask Parliament to do. The first is, in order to assist with mental health care, is to introduce and to bring back the amended liquor bill that says no selling of liquor inside near schools, raising the age of alcohol use, and above all, banning alcohol advertising. Now, having said that, I think there are other critical aspects. I support universal healthcare, but the fixing of primary healthcare has to be a priority. By that, I mean, for me personally, I will work, and I want to work on the Standing Committee on Public Accounts to see how every cent is spent at every level of the healthcare system, and to assist movements. I'm not going to Parliament as an individual. I'm going as part of movements. The critical question for me would be how movements work together with health committees, with the Minister of Health, and so on. Our duty is first and foremost to assist good civil servants, good public servants, and our duty after that is to hold accountable those who don't do their jobs.
Thank you very much, Zaki. That's great timekeeping. I would like to go back to Michelle Clark. I see, Michelle, your picture is on my screen again. Are you there? If you could unmute yourself. Yes,
I am sorry about that. I lost connection.
That is okay. Do you want to start again so that we can hear everything that you're saying in one shot?
Yes, I think that would be great if you allow me to do that.
That'll be good. I just want to check with our timekeeper to have the clock on the screen. There we go. Please start.
Okay, so we believe that social welfare as well as healthcare are hand in hand two issues that must be addressed as one issue, because the two of them really talk to each other. And in the face of this crisis, the DA stands ready to lead. And our vision for the first 100 days in government is clear: to confront food insecurity and healthcare head on, usher in a new era of hope and opportunity for all South Africans. Our social development policy underscores our commitment to address root causes of food insecurity in South Africa, where millions suffer of hunger and malnutrition, which has a huge impact on healthcare. Our approach is multifaceted, tackling issues of food production, access, and nutrition with targeted interventions. Firstly, we pledge to protect and expand social grants, shielding them from the scourge of corruption that has plagued our nation for far too long. Under the DA-led government, the child support grant will be increased to match the official food poverty line, providing much-needed relief to struggling families. The NHI bill, while well-intended, poses significant risk to our healthcare system. Instead, the DA advocates for universal access to healthcare through governance reform and collaboration with the private sector. We will lower private healthcare costs, enhance accountability, and ensure access to prescription medication nationwide. Removing political influences from appointments, we will ensure that every South African receives quality healthcare they deserve. In conclusion, the DA's plan for the first 100 days in government is a testament to our unwavering commitment to people of South Africa. We will confront food insecurity with compassion, determination and innovation, and also ensure that every South African gets the healthcare they deserve. A strong DA can rescue South Africa.
Thanks very much, Michelle. We now have our last person, panelists, certainly not the least, as it's the person from our current ruling party, the African National Congress, and they're represented by Dr. Confidence Maloko, who's the coordinator of the ANC's National Executive Committee on Education, Health, Science and Technology. Confidence, if you were to be South Africa's next health minister, what are the first two things you and the ANC would fix in our health system within your first 100 days?
Morning, everybody. Just like Zaki, I'm not aiming to be a minister of health. I've always been an activist in the Congress movement. Let me just remind everybody that health and education are national priorities, and that the ANC pledges to add to the good work that has been done by the democratic government, as aptly accounted for in the official 30 years review of government performance, by committing to urgently fix the health system and delivery of services as we go forward. Firstly, the ANC and its Minister of Health and his or her leadership collective in the National Health Council of the 7th Administration will do are to move with speed to firstly strengthen the leadership and management of the health system at all levels, and secondly, to implement programs that have already been designed to urgently transform and unify the public and private sector to ensure equitable access. These two priorities that must be experienced positively by the entire population in the first 100 days of the 7th administration and democratic governance are doable. They are part of the ANC well thought out 5-year plan that is detailed in the 2024 ANC election manifesto. They are the foundation of the request to voters that they must give, with trust and confidence, the ANC, an overwhelming mandate to ensure good quality healthcare for all. Strengthening the leadership and management of the health system includes rekindling greater focus on the primary healthcare approach and strengthening the district health system. Implementing programs that massively transform and unify the public and private health sector to ensure equitable access includes the implementation of the national health insurance. All of the above are possible because the ANC has the human resources and the experience of governance, and that is it. Thank you.
Thank you very much, Confidence, and thanks to all the panelists for sticking to your time limits. We're now moving on to the part of our conversation where we have respondents who are all health experts who will ask our panelists questions. Can I ask all the 6 respondents to please put on your cameras, but please mute yourselves unless it's your time to speak. While they're putting on their cameras, I'm going to tell you how things are going to work. The respondents will each ask a question or 2 questions to the parties that they will address, and the panelists will each have 2 minutes to respond to this question. Now, to prevent chaos or not have us all sit here for a very long time, we will have each respondent only address a question to 2 parties, and they know to which 2 parties they will be addressing their question. After the 2 parties have responded for 2 minutes each to the question, there will be 1 minute for the respondent to give feedback on what they think of the answers of the political parties. Now, our first respondent is Alex van den Heever. He's the chair of the Social Security Systems Administration and Management Studies at the Wits School of Governance. Alec will address his question to the EFF and the DA, and he's got 1 question for both parties. So each party, as I've mentioned, will have 2 minutes to respond to this question, and then Alex will have 1 minute to give his feedback on their answers. For the parties or the panelists, please remember that you're not going to have a chance to respond to Alex's feedback in the interest of time. So I'm going to ask the EFF to first respond and then the DA. But of course, first we have Alex who will be asking his question. Alex, the floor is yours.
Thank you. We're all aware of the fact that the public health system is facing a problem of systemic and endemic corruption and poor performance. And so the question is quite straightforward. What reforms your party proposes to ensure that will ensure that the health system both eliminates systemic corruption and achieves high quality performance? What specifically would you be doing to ensure that that result is achieved?
Laleng, we start with you.
Thanks. One of the most important elements for a well-functioning primary healthcare system is that we understand that it has to be responsive to the national and local priorities and that is accessible to all people. And in a true socialist country, the EFF will ensure that the profiteering of industry and private companies will not be prioritized over the right to health of South Africans. And the current over-reliance of tenders to provide public goods and services will be immediately stopped, because we know that the colluding of private companies to price hike has direct consequences and impact on corruption that has been so endemic and systemic in the public sector. We also know that private, especially Black practitioners, have also been hamstrung by the corrupt ways in which the health insurances and schemes have handled their own practices. And so we want the reports that have gone in to investigate the corruption of billings and the medical aid schemes and how they racialized Black professionals in the health sector to also be made public so that they are also held accountable. We also know that without a well-established infrastructure in healthcare, we cannot achieve the modern science, and that the practice of medicine itself becomes compromised. And it's at that level of internal capacity building and procurement of goods and services at the facility level where a lot of corruption also happens. A very clear example: all patients complain of poor nutrition when they're admitted to hospitals. All of us know of incidences where our loved ones have been admitted and they have poor nutrition. Why can state hospitals not able to provide for nutritious, healthy food for patients' recovery? Linen, a very simple laundry services. Why is the state not having capacity to provide for its own linen and capacity to provide healthy healing environment? So the management of facilities and the internal capacities to have stewardship is very, very important. So qualified managers.
Thanks, Laleng, for your response. And thank you for almost sticking to the time there. The DA, Michelle Clark, is now going to have her chance to respond.
Thank you very much. So we know that the healthcare system in this country has been plagued with endemic corruption. And we just have to look at the infamous digital vibe scandal during COVID-19 pandemic, which cost the taxpayer 150 million rand as people died at mass. Further, almost 5,500 contracts that were awarded during that period of time, 61.2%, were procured irregularly. This indicates the poor performance of our healthcare system in providing effective healthcare when it's needed the most. And in the past year, in the parliamentary question I posed to the minister, it emerged that nearly 50 corruption cases have been reported, but I think that's really just the tip of the iceberg, as we know government and reporting on these things. And with the president signing the NHI bill into power tomorrow, corruption in our healthcare sector is only set to worsen. By directing public and private healthcare resources to a politically appointed board, the opposite of universal provision will be achieved and corruption would deplete our coffers further. The DA's approach is to move our healthcare provision from a political actors to qualified health administrators working under an independent parliamentary legislative watchdog. A DA-led government will see the provision of healthcare, the building and maintenance of infrastructure, as well as appointments of personnel conducted independently, Rather than seeking to control our health sector, we will match the capabilities and the public and the private healthcare to ensure that quality care is accessible to all, regardless of your income. Thank you.
Thanks very much, Michelle. Alex, you have 1 minute and 10 seconds to respond, because we saved a bit of time there with Michelle's response to the answers and the responses of the EFF and the DA.
Yeah, so the issue of the removal of competitive bidding in public procurement doesn't appear to be a way to solve the problem of systemic corruption. It potentially may deepen it. The question is really, how do you ensure the structural independence of the supply chain management processes to ensure that they can't be manipulated by, in many cases, which we've seen in South Africa, political actors. So the question is a structural one. What structurally should one be doing? And I think that we've got a way to go before we've got the structural solutions in place. And unless the structural changes happen, it means that we can't really prevent collusion around any kind of bidding process in the public health system.
Thanks very much, Alex, and thanks for sticking to your time allocation as well. We are now going to move on to our second respondent, who is Anele Yawa. He's the General Secretary of the Treatment Action Campaign, which has a very long history in advocating for access to HIV treatment. And Anele is actually speaking to us from Kwakwa today, where he's leading a TAC march to get clinics in the area to adhere to policies to give patients with HIV treatment for 3 months at a time, so that they don't have to return to clinics each month. Anele, thanks for making the time to speak to us today. His questions are going to relate to HIV, as they should, and he'll address these questions to the ANC and to Zaki Ahmad. Anele has a question for each party, so he has different questions, one to the ANC and one to Zaki. Anele, if you could start with your question for the ANC, and once you've asked your question, we'll get Confidence to respond for 2 minutes, and then I'm going to get you to respond to his response directly so that we have each of those in a row. Anele, floor is yours.
Thank you, Mia, and greetings to all the panelists. My question to the ANC is to say, we have seen the HIV response, that the healthcare system of our country, if it wants, it can function. My question, if ANC is voted into power again, will the ANC force the members of parliament, cabinet, and MPLs to stop using private healthcare system and start using the public healthcare system in order for the healthcare system to work for all the people of our country?
Thanks, Anele. Confidence, you've got 2 minutes to respond to that, and please unmute yourself. Confidence, you need to unmute yourself. Thank you.
Thank you. I was under the impression that Anele was going to be asking a question on HIV. The question, I've got it on the use of public facilities. The African National Congress does appreciate the fact that it is very important for everybody, including the politicians, to use the public health facilities. But it does respect the democratic right of everybody, including the politicians, to use facilities of their choice. Now, when one looks at the cardinal or the main aim of the implementation of the funding mechanism, which is called the National Health Insurance, critical to that is that the National Health Insurance, the implementation of the National Health Insurance as a funding mechanism for the national health system, it is going to obliterate that divide that is between the private sector and the public sector. And by so doing, we will have, instead of the twin track system that we are having, after the election, with the implementation of the NHI as the legal framework will be in place, there will be no difference between the private sector and the public sector. and all the facilities that will give everybody care, it will be done equitably and everybody will have access. So the politicians, like everybody else, will be able to benefit from the transformed, not the reformed, but transformed health system that will have been facilitated or enabled by the correct and effective implementation of the NHI. Thank you.
Thanks, Confidence. Annelies, what is your response to Confidence answer?
I think our government is investing a lot of money to the private health sector through the subsidization of the public servants and the MPs, through the government employees medical scheme and parliamentarians using their medical scheme. Yet the problem that we have as the majority of the people is that the same government officials or political leaders are making laws and policies for the public healthcare users. Yet when them and their families are sick and dying, they don't access those healthcare services. Yet they continue to tell us about better life for all. And there is no better life for all if the majority of the people who are poor are supposed to spend a lot of money in order for them to access quality healthcare services.
Thanks very much, Anneli. And let's move on to your question for Zaki Ahmad now.
Thank you, Mia. Comrade Zaki, 2 million people of the 7.8 million of people living with HIV are not yet on treatment. If you are voted into power, how will you make sure that you push the government to make sure that all people living with HIV are initiated on treatment? Thank you.
Thank you very much, Anneli. I've got a few points to make on HIV, which I will. The first is to congratulate government for the major achievements in making ARVs accessible, except the breakdown of the systems now across the poorer provinces, which must be addressed as a matter of urgency. As we go through the epidemic and as the epidemic is maturing, two epidemics are taking root in our communities. The one is the comorbidities that are coming related to HIV. And the first one would be the question of obesity and diabetes. And we know, as TAC has been part of the campaign to address an integrated program that looks at diabetes, that looks at obesity within a comprehensive program. One of those is dealing with big food, labeling, and obviously the questions of access to medication. The access to medication this morning, the Guardian newspaper published a study which showed very significant incidences in heart disease, heart failure, and heart attacks if semaglutides are used and other medications. Similarly, the levels of obesity and the treatment of diabetes will be halved. Our duty is to make sure that those medicines come down in price. I think there's been a dramatic increase in stigma in relation to HIV. The HIV positive T-shirt that I designed and so on is no longer seen as a mass on a mass scale. And there is the question of stigma that has arisen is still self-stigmatization, most importantly, and the fact that there's no visibility on the questions, particularly, and that is critical for encouraging men to come forward. It's essential for all those questions.
Thanks, Zaki. Sorry to have to stop you there. Anneli, would you like to respond to Zaki's answer?
Yes, Mayor. Thanks, Comrade Zaki, for your response. As the people of South Africa, we have seen how politicians, and more especially those people who are in parliament, are stealing and looting from the public purse. And as the result of that, the majority of the people are denied essential services. And it is against that reason we want leaders who will go to parliament, who are corrupt-free, and who knows what is the mandate of the people. But in the main, it is our wish to make sure that those in parliament joins us on the streets when we are advocating for access for all people living with HIV in South Africa. Thank you.
Thanks very much, Anneli and Zaki. Our third respondent is Rahima Essop of the DG Murray Trust in Cape Town, which does extensive work in the field of early childhood development. Rahima will address her question to the DA and to Zaki again. She's got the same question for both parties to respond to. Rahima, please ask your question.
Thank you, Mia. I'm happy that the representative of the EFF mentioned nutrition in a previous question, because I want to talk about child malnutrition. 30 children die each day in South Africa because of conditions associated with malnutrition. That's a classroom full of children every day. In addition to that, we know that a quarter of children under the age of 5 are nutritionally stunted, which affects their mental and their physical development. So my question to both representatives, how does your party, or how do you plan to address child malnutrition, considering the fact that good child nutrition starts in the womb, it starts during pregnancy?
Thanks very much, Rahima. Michelle, let's start with you, the DA.
Thank you very much, and thank you for the question. Firstly, we need to ensure that there's adequate social grants put in place so that we can address malnutrition. And it is very important to increase the grants to the official food poverty line. This means that the child support grant under DA government will increase from 510 Rand to 760 Rand per month. We also have to ensure that these grants are also available right up until the national senior certificate level in order to assist. We've got to extend the child grant to cover pregnant mothers and put child nutritional goals in, and these grants must be available to the pregnant mother from date of conception. To make it must also be far easier to apply for these grants. And effectively, we need to target the vulnerable groups for protecting during food price shocks to ensure social workers have access to necessary resources to conduct their work and to ensure that they can assist where there's massive malnutrition. It is also important to extend the basic food items and exempt them from value-added tax, and this would include protein foods such as bone-in chicken, beef, tin, beans, margarine, peanut butter, and baby food, other food including flour, tea, coffee, and soup powder. We must promote food gardens to empower communities to independently enhance household food security in order to assist in terms of malnutrition. We must also have programs in place from ECD level. By strengthening these support systems, we can ensure that children in South...
Michelle, your time has come to an end there. I'm sorry we had to mute you. It's just in the interest of time. Let's ask Zaki to give his response now to Rahima's question about how will you address child malnutrition in South Africa. Zaki?
Rahima, thank you very much for your question. The major thing I believe in relation to child malnutrition and hunger is that family and societal hunger must be eradicated over time. There's no magic wand to it. I would like to work with a panel of experts that educate me and educates a movement of what works and what doesn't. The important questions I think that child malnutrition the step that would assist is a universal income grant, that will make families independent of the state and so on in accessing food. Secondly, I don't think urban household farming works. People don't have the time, they don't have the inputs, they don't have the training and so on. The question of small-scale farming is essential. Now, when it comes to babies, literally, I agree that pregnant women need to be given the best care that we can provide. And that's also going to take time. We mustn't make promises that we can't keep immediately. The critical thing going forward in relation to children is we must look at the ECD centers for little ones. We must look at them and give them the strength to have sufficient food there for children, because among the schools, among the ECDs in our community where poor people look after children, hunger stalks those centers. And it's our duty to make sure, just like the primary school nutrition program, there should be an ECD nutrition program. There are many things I could try and discuss more about food security in general, but on child malnutrition and stunting and so on, it's something that has been critical to known about forever, and I want to learn more.
Thanks very much, Zaki. Rahima, your response to Zaki and Michelle's responses.
Thank you both for the responses. I just want to add a few things. So in terms of making basic nutritious food more affordable to poorer families, we need to remember that not all children can access the child support grant. Around 2.5 million children cannot get it because they don't have access to the right documents or because their parents are foreign nationals. So while we do need to increase the child support grant, I agree to reduce the gap between the child support grant and the food poverty line. We also, 30 seconds, we also need to work together to make at least 10 nutritious food items more affordable to poorer families. And there is a proposal from DGMT on the table, and we need widespread support for this. Thank you very much.
Thanks very much, Rahima. And before we move on to our fourth respondent, I would like to remind you that if you have a question for either a panelist or a respondent during the time that there will be time for questions towards the end of today's discussion, please enter that question on your Zoom screen in the chat box on your Zoom screen. If you're joining us via YouTube and you don't have a Zoom screen in front of you, please tweet us your question or ask us your question with one of the hashtags that we provided. Bhekisisa Webinar is probably the one that we will pick up the easiest. So use that hashtag to tweet us your question if you are joining via YouTube. Let's move on to our next respondent, who is Yvette Raphael. Yvette is a well-known HIV and gender-based violence activist, and she's the executive director of Advocates for the Prevention of HIV in Africa. Yvette is going to address her question to the EFF and the ANC. Yvette, please ask your question, and then let's start with confidence from the ANC to respond first.
Thank you so much, Mia, and what a great day to discuss health and politics. When it comes to gender-based violence in South Africa is a crime scene. Nowhere is safe, particularly for women. The ANC government has dismally failed to prioritize GBVF and to end the scourge. Instead, GBV programs are not being funded and Thuthuzela centers are being closed nationally. A justice system that continues to fail our victims. We can only attribute this to corruption and incompetence. Young women as young as 12 are giving birth, and evidence tells us this is rape. However, this is not translating into any convictions. This country is a crime scene, both the EFF and the ANC. What are your plans to make South Africa safer for women, and why should women in particular vote for you?
Thanks very much. Thanks, Yvette. Confidence, could you please respond to Yvette's question and specifically about what the ANC would do and the allegations of corruption as well?
The African National Congress, in its priority number 5, which is defend democracy and advance freedom, it has very clearly identified the fact that over the next 5 years, it will promote and defend the right of all South Africans against racism, sexism, gender-based violence, homophobia, discrimination, and other intolerances. And that it will also intensify the war on crime and make our communities safe. and that includes action against drugs, organized crime, gender-based violence, and femicide, and infrastructure, vandalism, extortion, and gangsterism. The ANC aims to end gender-based violence and femicide by implementing the National Strategic Plan on Gender-Based Violence and Femicide, by expanding victim support services like Bhekisisa centers and gender-based violence desks in police stations, undertake public campaigns against toxic masculinity, sexism, and homophobia, promote gender equality and empowerment of women and girls, and promote adherence, working with trade unions and businesses to the ILO Convention 190 to eradicate violence and harassment in the workplace. Thank you.
Thanks very much, Confidence. Let's move on to the EFF to respond to Yvette's question. Dr. T.
Thank you so much. The EFF government knows that violence doesn't originate in a vacuum, but also in context of extreme inequality and multiple forms of discrimination, and therefore looks at issues of gender-based violence as also violence against the state. Violence is not a private matter that should be just dealt with between families in a private setting, and therefore takes very seriously the ways in which currently the government has failed in their own obligation to effectively investigate and prosecute and punish cases of domestic violence. And as such, the EFF government will make sure that they comply with both international but also national obligations to ensure effective capacity building for the judiciary and law enforcement, to ensure that the current backlogs in terms of DNA testing, especially for rape kits, become resolved, and that there's capacity building and increasing of those state-of-the-art laboratories to actually facilitate timeous DNA cases, so that when victims open cases of rape or any other kinds of violence, that their cases can be dealt with expeditiously. We know the secondary victimization that many victims go through at police stations and through court cases as well. We also know that a lot of the violence that happens goes unpunished simply because victims do not have the necessary resources for legal support, for transportation fees, to constantly be attending court. And so the EFF government will make sure that the interventions are framed within a comprehensive multi-sectoral response, addressing all of the needs of survivors that they need and their families, that they are referred to specialized services in a multi-sectoral way, that they have financial and legal support, safe accommodation, accountability, and redress. Many people at this point, we're expecting survivors to flee their homes. But what should be happening and what will happen under the EFF government is that gender-based violence will be treated as a serious crime, and perpetrators will be the ones who are jailed and leaving the homes, and that survivors and their families will not be interrupted in their daily life.
Thanks very much, Tlaleng and Confidence. Yvette, would you like to respond to these two answers of the ANC and the EFF to your question?
Thank you so much, Mia. Once again, I say, as women of this country, we have seen the scourge of gender-based violence and just how difficult it is for women in this country when it comes to being raped and being killed. We will not vote for any party that has had any opportunity to ensure that women are safe. And we will not tolerate promises that are not kept. So, and be sure to know that going forward, this country has to be safe for women, for children, and for everyone that lives in it. We are not free until everyone is free. Thank you.
Thanks very much, Yvette. We're now moving on to the subject of universal access to healthcare, which in South Africa is widely known as the thing that the National Health Insurance Scheme of the government is trying or aiming to achieve. And in order to ask a question about this, we wanted to get a medical doctor in practice in South Africa to ask questions about that, as they would be directly affected as a healthcare professional. And we asked the chairperson of the South African Medical Association to respond to this, Bhekisisa Webinar, but I don't see him online at the moment. Bhekisisa, if you are online, could you please unmute and put on your video if you perhaps hear under someone else's name? So I don't see him, but he did send us his questions beforehand. And his questions would be addressed to the DA and the ANC. And he's got a separate question for each party. So Michelle, let's start with you from the DA. His question to you is that SAMA supports universal access to healthcare, but they are concerned about the NHI bill in its current form. And as you've mentioned before, this bill will be signed into law tomorrow by the president. So his question is, how can the Democratic Alliance ensure that its health manifesto guarantees access to health for all, despite the perception that the DA tends to cater for advantaged communities and not for disadvantaged communities? You have 2 minutes.
Thank you very much. And I don't think that's true at all. We are a party for all people in this country. And SAMA, we have collaborated with them often, and they don't support the NHI either. So the DA is committed to universal health care for all citizens. We will leverage the strengths of the private sector and partnership with the public sector to improve health facility and ensure quality care for all. So the DA will lower healthcare costs and guarantee a minimum package of services. We will do so through increasing competition in the private sector to lower private healthcare costs out-of-pocket payments. And we will also introduce a social reassurance and implementing a mechanism of a risk equalization. The DA will also address corruption and enhance accountability, removing political actors from the provision and administration of healthcare, establishing an independent watchdog to supervise all processes from the Independent National Appointments Authority. We will ensure that necessary infrastructure is built and maintained through ensuring all capital expenditure is directly financed and controlled by health facility administrators and not public works, whether national or provincial. We ensure health facilities are adequately staffed through developing a national work plan to identify skill shortages and to ensure that we have sufficient doctors, nurses, and administrators in the system. The DA will ensure that all has access to prescription medications nationwide through establishing a national prescription register that allow patients to collect repeat prescriptions at any pharmacy in the country. Furthermore, the DA will improve the monitoring and evaluation of the OHSC, and the DA remains steadfast in its commitment to universal access healthcare to all South Africans. We believe that by harnessing the strengths of both the public.
Thanks, Michelle. I'm sorry we have to mute you there in the interest of time. I would like to ask Yvette, who is one of the respondents who spoke about gender-based violence, to attend and to listen carefully to what our politicians are saying and give us a response after this. Since we don't have SAMA online to directly respond, we're going to move on to the ANC, to Confidence now. Confidence, the question of SAMA, the South African Medical Association, is that they're concerned about the NHI bill in its current form. And the question is, why does the ANC push for an unworkable system at the expense of the health and welfare of South Africa's citizens? They ask, is it not better to put the funding towards improving our ailing public health system instead of trying to implement a new system? Confidence, you've got 2 minutes to respond. Confidence, are you there?
I have heard the question, and I've also heard the response that had been given earlier on. The National Health Insurance Act, which will be the framework given to South Africa tomorrow, through the signature of the President of the National Health Insurance Bill, will provide the health system with a necessary legal framework for strengthening the public and the private sector as one, not as two separate systems, and further develop a democratic, unitary, non-racial, accessible, equitable system, just and a good quality health system for all South Africans. We must remember that universal health coverage is defined herein as the health coverage that results in universal access by the citizenry to preventative, promotive, curative, and rehabilitative services that are available to all and are accessed equitably and efficiently without resulting financial hardship. Anyone who is saying that we must keep what we are having now means that in the same way as the person says we support universal access but keep what is existing now, it means that we must just leave the status quo the way it is. The National Health Insurance in its present form is a healthcare financing mechanism that is designed to facilitate universal access and equity for everybody, black and white, rich and poor, and it will prevent the continuation of the kind of status quo that is supported by the DA and that is supported by those that argue that things must remain the same. Thank you.
Thanks very much, Confidence. I'm going to ask Yvette Raphael, as a user of public healthcare services and both private as well, to respond to both of these responses. Yvette?
Thank you so much, Mia. And I'd like to say to the ANC, the NHI in the hands of the ANC is a scam. One of the things that continuously come up is their inability, incompetence, and their love for corruption that will drive this initiative down. I, as somebody who grew up in the villages, knows a hospital that was driven down to the ground because it was one of the pilot hospitals for the NHI. The ANC should not lie to the people of South Africa that this means everyone will be having access to any clinic in the country. Just like the schooling system that they've run down, it means you will have access to the clinic where you are based. So you will go to Pumulong if you are in Pumulong, Tembisa in Tembisa, and the people in Sandton where the hospitals will be kept, and those private clinics will have access to that. I would love for everyone to receive equal health, but with the ANC, this is a scam and they are corrupt. Thank you.
Thanks very much, Yvette. We're now going to move on to our last correspondent, who is Sekutlani Pamodi of the New Economy Hub, which works in the field of climate governance and partners with people and organizations working to decarbonize South Africa. And as you would know, the consequences of the climate crisis has huge implications for people's health. So Sekutlani will address their questions to the EFF and to Zaki Ahmad. Sekutlani, let's start off with the EFF.
Thank you, Mia. Climate change and population health scientists say that extreme weather events will likely cause about 250,000 extra deaths a year from around 2030. They tell us that climate change will make infectious diseases such as malaria, or TB and HIV, as well as other diseases like malaria, to spread more easily. What is your plan to mitigate the human causes of climate change in South Africa and improve health outcomes for people as we go deeper into this ecological, economic, and social crisis? Thank you.
Thank you so much. Thanks, Mia. The issue of the climate crisis as a global agenda is well understood, and we know the green economy and the push for all of that. And I think in the context of South Africa, we also know environmental degradation at the hands of greedy business and extractive capitalism and related activities leading to air, water, and land pollution. And with apartheid, we also saw that Black people were then segregated to these inhabitable areas. And under the EFF government, it has been clear the issue of land as reparations, as justice for Black people. And so it's important to talk about this physical and mental impact of the climate crisis, but also environmental degradation as indigenous peoples of this land whose land was stolen from. And so the EFF is unwavering in that commitment to land without expropriation. And what's important is that the financing of reparations for injustices of the past that we are now trying to correct through systemic and long-lasting change as the EFF government cannot be as well at the hands of unfair lending practices, pushing of public-private partnerships at high interest renting rates, as well as costs and high costs of servicing those loans by international monetary funding systems. In order to get jobs and more jobs for people in this country, we have to realize that we are a developing economy and make peace with the fact that South Africa is a developing economy. And we remain in solidarity as the EFF with the rest of the African countries who themselves know the compounding impact of colonization and exploitation. And so under the climate crisis, but also degradation of the land, we remain committed to ensuring that as the EFF, we restore the land, we respect the land, but also we assist all of us as we move forward to prosperity in a true socialist economy and country, understand the principles ultimately that all of us have to thrive in this country and not merely just survive. And it is for all of us and not just greedy extractive capital.
Thanks, Darling. I'm sorry we had to mute you there towards the end. Sikutlani, what's your response and comments on the responses of these two politicians? You've got 1 minute.
I think at this point we've only heard from Dr. Tlaleng here. I was hoping to hear from
I apologize. Let's go to the other respondent. That will be Zaki Ahmed, if I have that correct. Yes.
Yes. Thanks, Sikutlani. The question for me has to be, how do we use within health, the healthcare system, what do we use to ensure that the health of our people and all people globally becomes a priority during this crisis? Floods, desertification, fires, and so on. We know what causes it. We know what the scale of it is. So the questions I want to respond to is, I don't have the power to change. I want to work, and I'm working with movements and so on that deal with the question of fossil fuels and so on. Having been a child who grew up in a house where coal was burnt for most of my childhood and youth, the question of health, lung diseases, sinuses, and so on, I think the underestimation of the health impact doesn't take into account right now the lack of electrification and its impact on communities, on households, and so on. So the first thing is to ensure that housing in informal settlements and working class communities get access to solar power. The second is to ensure that in every state building, right now, we campaign for solar to be installed and for buildings to be retrofitted. And the last question in relation to what we can and must do is that, as COVID shown, health and what is taught in medical schools needs to shift to teaching about emergency medicine, because the critical thing here is, how does a woman give birth in a situation where there's no water? Our duty is to look what MSF and other global emergency care bodies have done. I'm going to stop there, Mia. Thank you.
Thanks, Zaki. Just before Sikutlani gives us his comments on the answers of our two politicians, I would just like to remind you, if you have a question, please enter it in the chat box. We've already received a few questions. Thanks for those. Or if you're joining us via YouTube, please tweet us your question with a hashtag Bhekisisa Webinar. Sikutlani, you've got 1 minute for your comments on the responses of our two politicians.
Thanks, Mia, and thanks to the contenders. I think it's going to be really important for us in order to be able to ready ourselves and the health system for the worsening impact of climate change on population health, for us to really pay attention to the role of fossil fuels in causing this crisis for us. The first thing is that these health impacts of fossil fuels are already here with us. If you go to places like the Mpumalanga Highveld, the Vaal Triangle, and the South Durban Basin, we are already seeing how heart disease, lung disease, and other serious diseases are already impacting people and overburdening the health system. The response has to start with ending coal, number one, and strengthening surveillance and healthcare management practices in those areas in order then for that to cascade across the entire health system. We need to start urgently because we're already late in terms of dealing with things such as global heating, extreme weather events, and so forth, and their implications for public health. Thank you.
Thanks very much, Sekutlani, for that response. We now have come to the last part of our discussion today, which involves your questions as the audience. And I'd like to ask the respondents to please stay online as well, because we'll involve everyone with responses to these questions. And the questions I'm going to pose to our panelists and respondents are a combination of the questions of when you registered. Many of you did give us questions already. Also, some of the questions that we received online today. I'm going to start off with a question of Atia Mosam that is for the DA, ANC, and EFF, and our respondents and Zaki could also respond if they'd like to. And that question is, NHI aside, what is your approach or view on engaging the private sector to provide universal health coverage for South Africa? Let's start with Tlaleng from the EFF.
So the EFF government believes that there's only one health system, and that's it, right? And that the two types of health systems that have been allowed to happen under the ANC is basically to serve the interests of the rich people and the ANC itself. And what will serve the country and the majority of the population of the country is to have one public health system. The NHI currently still relegates the Black people, the poor people, people in rural areas to the same fractured, fragile health system that is dysfunctional, because it still demands of them that they remain seeking help in those spaces which they occupy. And I just spoke about being segregated. I'm still living in a Bantustan area in Kwadwa, and my community is still dying today of preventable diseases. We still have family members who cannot bring babies alive from a hospital because of a lack of cesarean sections, long waiting queues in hospitals. Even under this NHI that they think is a magic bullet, those conditions will not change because they are not doing systemic work that is required. They are still defunding the health system. A lot of what is needed in terms of the funding of the health system is that they're depending on international and foreign aid for them. So the NHI and the ways in which the ANC government is approaching is all wrong. And it's actually just making the ground fertile for more private sector. Under the
Thanks, Tlaleng. Thanks, Tlaleng. I'm going to stop you there. Michelle, can you respond on behalf of the DA? And can you try to give your response in about 1 minute? I'm going to give you an indication of when 30 seconds is left.
Sure. And the question was how we would interact with South Africans in terms of the NHI. Now, I am a member of the Health Committee, and during the NHI period where stakeholders were supposed to come and give input at the committee in terms of the NHI and recommendations, well, that was done, but not one recommendation was taken into account. And you will recall that the day the NHI bill served at the NCOP, it was stopped in its tracks because there were many big players in the health system very upset because none of the recommendations were taken into account. And even all the opposition parties, each one of them had put in recommendations which were not taken into account. So with the minister having all power in terms of the judge and the jury and what has happened to separation of powers, I just think that this whole bill will be a wholesale corruption deal coming into practice and in terms of government. Thank you.
Thanks, Michelle. Confidence, if we could get your response specifically on how you think the private sector should be involved in providing universal health coverage, and how, with the NHI, you're obviously going to create one system, but how do you think the private sector should be phased in or handled in this process in the lead up to the NHI?
It has been said many a times that there is going to be a period which is transitional when the legal framework is being used to implement the NHI. The NHI is designed to transform, not to reform the current single but twin track health system that we put in place from 1994 to date. It is designed to transform the national health system into a formidable vehicle where the private public divide will be done away with and equitable access will be the new norm. I'm very glad that Michelle Clark has mentioned that very powerful forces have tried to interfere with a very inclusive and transparent and legal, the lawmaking process. And I think that is one of the things that the people of South Africa must be made aware of, that no one was supposed to have done that. Thank you.
Thanks, Confidence. Zaki, I'd love for you to respond. And then after that, Plix van den Heever, I would like for you to respond as well to how do you think the private sector should be involved in the suggestions that we've just heard from politicians. Zaki, 1 minute. Zaki, you must unmute.
Alex, and I'm sure Alex is going to go into detail, but I think the health market inquiry into the private sector provision must form the basis of government's response. I would like us to seriously engage the drug companies to bring the prices of medicine down, particularly semaglutide, and also the alcohol harm reduction meds. So those are the sorts of things that we need to engage in, and if not, if they don't play ball, then there's sufficient laws to address those questions. The question of over-servicing is a must. And then we have to discuss with particularly the private hospitals, in order to lift the burden of the public sector. How many people living with HIV could go to the private sector to collect medicines, to have bloods taken and so on, so that we lift the burden of the public healthcare sector. And last, I think we should not give in to the private sector in deep interests.
Thanks, Zaki. Alex, if we could end with you. 1 minute. Alex, are you there? I see Alex online, but perhaps he is not at his screen right now. Instead of Alex, can I ask Sikutlane, you are a climate change person, but you're also a user of the health system. What would your response be to how the private sector should be involved in giving everyone access to health?
I think thanks, Mia. I think that some of these issues have been well covered. First, we need a unified health system. Part of the causes for the high cost of healthcare in our country is because of the history that created this divided healthcare system through privatization. We need to unify the health system. We need to regulate prices of care, the price of care. We need to raise the quality of care, which means also really improving the conditions of healthcare workers, particularly in the public healthcare system. And as Zaki has also indicated to us, we have to ease the burden on the public healthcare system, which is not caused necessarily by corruption or maladministration, but because of the overwhelming need by people who cannot afford private healthcare and have to resort to public healthcare in order to have their needs met. So we really need to unify, manage correctly, improve the quality of care, and ensure that privatization doesn't result in outpricing the poor. Thank you.
Thanks very much, Sikutlane. I'd like to move on to a question of Tandi Maluka from the Positive Women's Network. That is a question that we issue we hear about so much reported in the media lately. The question is, what change will you as political parties, if you come into power, bring in order to address the issue of safety and security of our healthcare workers who are being robbed, some being raped while they are on duty, and sometimes patients being victims as well? Let's start with you, Confidence. Confidence, are you there?
Yes, thanks. The problem of security within the health service, within the health services, from our emergency medical services to the mobile clinics, through the clinics, the fixed clinics, and up to the hospitals, that is quaternary, the academic hospitals, is a problem that we have had throughout for very many years. There are a number of things that have been done. Some of the things that have been done have been localized, where the people that are operating, for example, the mobile clinics or the security at the level of the hospitals would be improved. But what we must realize here is that unless we involve our communities and we return the country to a situation where it is not a country with too many laws and no order, we are not going to be able to have security in the hospitals if we do not have the security in the communities. Thank you very much.
Confidence. Darling, let's ask you, you're a medical doctor yourself. As the EFF, what will you do to keep our healthcare workers safe?
Well, I can tell you what we want to do is that we want us, the community, to be its own security and police. What we will do as the EFF is ensure that safety and security is taken seriously in this country, that the policing itself becomes a professionalized service, and that corruption has consequences. Currently, you do have a lot of dysfunction happening that impacts the ability of the health system to be functioning and accessible and of quality. And we know that policing and safety and security is a big part of that. And having security or having ambulances be escorted into communities is not sustainable. But putting the burden on communities is completely unfair. I think what we need as well is to realize that the capacity of the public service and civil servants to do this work in remote areas becomes the responsibility of the state. The duty of care remains that of the people who are the employer, which is the government, and we will take that very seriously for lodging as well in their accommodation.
Thanks, darling. Michelle, what will the DA do to improve the safety of healthcare workers?
Well, firstly, very much same answer. You must professionalize your police force to ensure that you have more boots on the ground in order to assist in terms of safety and security. But secondly, you've also got to stop the security companies that are being employed by the government through, cadre deployment, and making sure that the security companies that are actually employed to look after hospitals and the safety of patients and our healthcare workers are sufficiently trained in order to do so when there's an emergency in terms of safety and security. And that simply is not happening in our hospitals at the moment. Our security systems that are being employed there are certainly not trained to deal with violent crimes that often happen within our hospitals against our healthcare workers as well as our patients. And that needs to also be dealt with.
Thanks, Michelle. We have time for one more question before we end today's webinar. And I'd like to use that question for a closing statement because it very much leans itself to it for all our panelists and also our respondents who are still online. And that is a question from a freelance journalist, Elna Schutz. And the question is, how are you planning to close the gap between good strategic planning and ineffective implementation in the health sector? So that thing about South Africa having really good health policies, but when it comes to implementation, we so often fail. So I'm going to ask our politicians to first respond, and then our respondents to give advice as to how to do this. Let's start with Zaki Ahmad. Zaki, please unmute yourself.
Hello. I'm struggling a little bit with my internet. So, Mia, first I want to say this is the most perfectly organized interaction on policies I've had in this time. I think we must look at different things that can assist. First and foremost, everything promised on this platform today. We haven't looked at the costing, we haven't looked at the training and so on, but most importantly, we haven't looked at the way communities need to directly participate within the state and within government to ensure that all services are properly provided. The treatment action campaign is, I want to simply finish off by saying, when I am in Parliament, one of the second thing I will do is ask for a commission, a Truth and Reconciliation Commission on HIV.
Thanks very much, Zaki. Tlaleng, let's hear what the EFF will do to improve the implementation of policies.
Thanks, Mia. One of the things that is important is redress, monitoring, transparency, and being able to account for when things work or not work. And I think that's a big element of being in good governance and being in positions of leadership. And transformational leadership is about modeling good behavior and good performance. And in the EFF, it means that that modeling of behavior starts at the top and it infiltrates all the way down. But we also value meaningfully and consequentially the participation of rights holders. This means that the EFF continues to work very much on the ground, connected to the communities whose rights we work to protect and to promote and fulfill and to respect. And we make sure that they are able to hold us accountable. And one of the ways is to make sure that citizens knows the channels to use to hold public servants accountable for when things go wrong, and that there must be clear processes for redress and participation that is consequential for them, that their rights can always be protected and respected always.
Thanks, Tlaleng. Michelle, let's hear what the DA will do to improve policy implementation.
Well, I think it's extremely important that government reforms and collaborates with the private sector in order to make our healthcare system work. Because I do believe that the private sector has a responsibility to uplift healthcare in our country. And through partnerships, we can do that. So that is extremely important. And then, in terms of dealing with fraud and corruption, an open and transparent government is very important. So you can't have one person controlling the whole system. So that's important. And I've actually done a private members bill where we can train our doctors and our nurses within the private sector, because they've said they will help us to do that, because we do not have the capacity to do this in government hospitals, and so that we can uplift the care we give to patients that are in public healthcare systems that we currently battle with at the moment, because we have an incredible scarce skill at the moment. Thank you.
Thanks, Michelle. Confidence, what will the ANC do to improve the implementation of good policies?
Election campaigns are not an exercise of fun and populism. It is a serious exercise to get the mandate to serve and to lead. So it is very important that, having got an overwhelming mandate from the voters, that mandate must be translated into government programs and government plans. And when that has been translated into government plans and government programs, we must have a situation where the bureaucracy does not become the bureaucratic tail that wags the political dog. So for us to have effective implementation of policies, it means that we must have a firm political leadership that will result with a bureaucracy implementing that mandate that has been earned through votes. Thank you.
Thanks, Confidence. Let's hear from our respondents for a bit of advice. Sukudlani Pamori, what do you think we need to do to improve the implementation of policies?
Thanks, Mia. We are in a context where our social and political compact is really fragile and at risk to populist statements and promises that result in nothing. Fundamentally, our society needs 4 key things. 1, transparency in governance. We need to know what informs decision-making and whose interests are served by those decisions. 2, we need participation, deep participation from the people who are affected by these decisions, so that we can have a dynamic feedback system that helps us to get the outcomes that we need and want and deserve. 3, we need accountability. Accountability means that our leadership needs to come to the party and account for what they have done and not just tell us a story of how good and amazing they are. Lastly, we need redress for wrongdoing. Wherever there is wrongdoing, we need to see that accountability is there, and 2, that there are clear consequences for that wrongdoing. Thank you.
Thanks very much, Sukudlani. Let's go to Rahima Esop of the DG Murray Trust. Rahima? Rahima, are you there?
Yes, hi. Thank you, Mia. You know, I'm glad we had an opportunity to talk about child malnutrition, but I also just want to touch on an issue that 1 or 2 of the panelists touched on, and that was reducing alcohol harms. You know, it's imperative that to reduce alcohol harms, we will see the benefits, not only in terms of the societal benefits and benefits to the public health system, but also the economy as well. And we must reduce the harms of heavy and binge drinking on our public healthcare system. And we can do that with strong legislative framework. As Zaki Ahmed pointed out, we need to restrict liquor trading hours, introduce minimum unit pricing, and apply limitations on advertising. So that's just another point that I wanted to bring out, in addition to my contributions on child malnutrition, because I do feel that both go hand in hand if we consider the effects of fetal alcohol syndrome on children in our country. Thank you very much, Mia, for the opportunity.
Thanks, Rahima. We have Alex van der Neefe and Yvette Raphael left. Alex, are you there? Can you hear us? I think Alex might not be at his computer, so let's end with a statement from Yvette Raphael about how can we improve the implementation of policies. Yvette?
Thank you so much, Mia. I think what is important for any government that will be voted in after 29th May is to know that at the center of this is the communities. At the center of this is the South Africans who are expecting them to work for us. I think what we've seen for the past 30 years is a government that does not put communities at the center. We may argue about this, but make sure you implement the policies. You owe it to the people who voted you in. Thank you.
Thanks very much, Yvette. I just received a message from Alex that is still online via WhatsApp. Alex, can you hear me on Zoom?
Yes, I can.
If you could respond to us to the last question about how can we improve implementing policies, that whole thing about we've got policies, but when it comes to implementation, we fail. How can we improve on that? 1 minute.
So first of all, that argument, which has kind of been prevalent since 1994, is what I've got as a sort of as kind of nonsense. The issue is bad policy doesn't get implemented. So policy processes involve solid, substantive engagement with society, creating policies that you've properly appraised and investigated. And when you do that, and you've constantly, iteratively engaged with society, your policies get implemented. But if you're basically completely abstracted from society, create paper plans, and then basically it doesn't happen. So at this point in time, I would say that a large part, I would say that the national level of health policy creation in South Africa has lost the capability to make coherent policy, strategic policy in South Africa. And a large number of our provinces are in the same position. They've hollowed out. So we basically got to completely rethink how we're governing in South Africa.
Thanks very much, Alex. On that note, we've come to an end of today's discussion. Thanks very much for all the panelists and the respondents for their time and for sharing their insights today. A recording of the webinar is available on our website, bhekisisa.org, and you can also find all the live tweets our team sent out on that page. It's embedded on there. By tomorrow morning, we'll have a bullet point summary of this discussion ready, along with highlight clips that you will be able to access. And we will email everyone who registered for this webinar a newsletter with a link to that page, along with a short survey, which we will really appreciate if you take the time to fill it out. It's only 3 to 4 minutes to fill it out. Thanks very much for all your time and your effort to join today and for being part of this discussion. I hope you feel a little bit better equipped to know who to vote for. Have a lovely afternoon.